everybody, it's Adam from the Rural Health Workforce Transformation Hub, and in this video I'm going to give you a brief overview and analysis of Iowa's Best and Brightest Recruitment RFP, part of their Rural Health Workforce Transformation Fund group of RFPs. Iowa is proposing to spend $18 billion on 150 recruitment relocation grants worth $120,000 each for nurses, physicians, or physician assistants. I'm going to tell you what I think about it in this video. So, launching in, this is going to be the standout recruitment and relocation grant of the last 5 years. Since COVID, we haven't really seen such amounts being thrown about, particularly in rural healthcare. And imagine that headline, $120,000 if you as a nurse move into our area. If you're a nurse earning $80,000 in Des Moines and somebody says, here's a $120,000 sign-up bonus when the standard bonus is like $20,000 in a city, that's going to get attention. You're going to get people that have never thought about moving into rural healthcare actually considering it for the first time because of the money. However, there's a few things about this that I'm a little bit uncertain and pessimistic about their positive long-term effect on rural healthcare workforce recruitment. First one is $120,000 must go to the staff directly. So that nurse or that doctor, that physician assistant, they have to get the full grant amount. There's no insertion of admin cost or funds that can go on recruitment agencies, for example, or funds that can go out to marketing, or funds that can buy out travel nurse contracts. It all must go to the providers. And this is a good thing because the money's going to be spent in the community and it's not being filtered and spread along, 5 to 10 different providers, everyone taking their little cut. However, it's also difficult to implement if you don't have a lot of resources in-house and you're being asked to plan and execute this method of spending a big chunk of money. It needs to be spent by September 2027 on, I think it's maximum of 6 healthcare staff could be hired and paid $120,000 each. You're going to perhaps struggle with managing a few elements. Now, one is current staff. So how do you keep them happy if you're bringing in people from the big smoke and giving them 120 grand whenever, say, someone's been there 5-10 years and they're not getting anything? That's going to be difficult to manage in terms of public relations side of things and staff engagement and satisfaction. There's also a case of if a nurse sees this and they live 50 miles away from town B, they live in town A right now, why not just move into town B and take your 120 grand there? Someone from town B moves into town A, and people are kind of being mixed about the existing system. Also, there's a reporting element in this. Healthcare organizations have to make a recruitment plan. A lot of things that money will need to be spent on to facilitate this that can't be funded by the grant. The grant is already a lot of money. It just seems to me that it's a bit of a waste to not say 100 grand bonus and then 20 grand you can spend on actually implementing and making the bonus and the recruitment go into a good pathway. So it has to be paid in a lump sum. It can't be really paid out across 5 years because it needs to be distributed by September 2027. And they haven't specified how it'll be clawed back if someone leaves, but they said that there will be a mechanism for that. So it wasn't really what I was expecting when this came out. I was expecting to see more flexibility in terms of how money could be spent, more ability to put it into training or innovative ways of helping people with housing or childcare or supporting spouses in their careers. And it just seems like this all has to go into one place, which is the hands of healthcare providers, which is good in some ways, could be a lot more poorly distributed. However, I'll be interested to see how organizations come up with the resources to actually get these out and get them marketed to the right people. No doubt there will be a lot of interest because that bonus is a big lump sum, but we'll need to see if it can be efficiently distributed. Because, now this is another point that I had, you need to hire them in person, full-time, they have to be committing for 5 years, and you can only do it on those positions: doctor, physician assistant, or registered nurse. And somebody asked in the Q&A for this if they can do 6 lots of $20,000 to use that 120,000. 6 lots of 20,000 per nurse, for example. So each nurse gets 20 grand. That's more of a market rate. And essentially, Iowa Health and Human Services said no, and it must go to one provider, which is crazy for nurses to be getting $120,000 sign-on bonuses. I cannot imagine the reaction of some nurses when they see this. There's gonna be a little bit of uproar, I think, whenever this comes out, and ultimately not throwing shade at Iowa Health and Human Services, but the way this program designed is not optimally set up for how rural healthcare can be fixed, particularly on workforce. It seems that Iowa Health and Human Services, in the Q&A, they constantly refer back to the agency follow all funding restrictions and requirements provided from the CMS for the Rural Health Transformation Program. It seems like they have fixated on this idea that if they're funding recruitment, they need to put it all into those bonuses, and that's what they're rigidly stuck to. We are seeing some states focusing more on retention bonuses, training bonuses, so we'll see if they're able to put that out in their RFPs, but at least Iowa is centered in on this. So if you're in Iowa, you have, I think it's the 5th or the 6th of January. You don't have long to reply to this, but if you need any help, do let me know. It's the 5th of January at 4 p.m, so a little bit of time. If you're not in Iowa and you're looking at what your state's doing, then do get in touch. We are, through our Rural Health Workforce Transformation Hub, we are following this program and how it's going to be spent throughout, and we'll be putting lots of tips on our website, nurserecruitmentx.com. You go onto the blog and see if there's anything on your state there, or indeed just reach out to me and we can strategize how you can get these funds. But exciting times, interesting times for Iowa at least, and interested to see how these funds get spent and distributed over the next 5 years. I've been Adam, thanks for watching, and wish you a very happy new year.